Blood everywhere, soaking through layer after layer of clothing, despair echoing in the air as if it were a living, breathing thing. If this sounds like the opening scene of a murder mystery, think again. This describes what some women experience regularly during perimenopause. Extremely heavy bleeding that starts and stops at random times, making it impossible to plan outings with friends and family. Keeping midlife women away from work and trapped in their homes, usually isolated and ashamed, impacting their ability to function in all parts of life. One of the hallmark symptoms of perimenopause is changes to the normal bleeding associated with your menstrual cycle, usually concerning the length and timing of the menstrual cycle, but these changes can also affect the color and the texture of the blood. But for some women, these changes go further, with bleeding so heavy it causes fatigue, increases the risk of iron deficiency anemia, and has severe emotional impacts. Now, what are the indicators that your bleeding is very heavy? The signs your healthcare provider looks for to identify menorrhagia, which is the formal name for very heavy menstrual bleeding, include whether you soak through one tampon or pad every hour for several hours, whether you need to use a tampon and a pad, so double protection, or even a diaper to manage your menstrual flow, if you have to wake up to change your pad or tampon, if you bleed for more than 7 days at a time, and if you bleed, not spotting, but proper menstrual blood, more frequently than every 3 weeks, and or if you have a menstrual flow that contains blood clots larger than the size of a quarter. Heavy bleeding happens when your changing hormone levels impact the length of time your endometrium, which is the lining of your uterus, builds up between periods. The longer the time between periods, the more uterine lining will need to be shed, creating this very heavy clotting blood flow. Heavy bleeding can also happen when the length of time that your endometrium builds up stays normal, but the lining itself overgrows due to perimenopause hormonal fluctuations. So what can women do to help ease the impacts of this harsh symptom? Firstly, it is important to talk to your healthcare provider to rule out other causes that could be signs of more serious problem, like endometrial hyperplasia, which is abnormal growths inside the uterus. When perimenopause is confirmed as the source of the bleeding issues, there are 2 frontline treatments. Firstly, oral contraceptives may be prescribed, and they can be effective on their own for many women. However, if the bleeding persists, inserting an IUD that releases progestin can be extremely effective therapy. Now, if neither of these work, there are surgical treatments, such as something called endometrial ablation, which is the surgical removal of the lining of the uterus, or there could be surgery to remove cysts, if those are there. Extremely heavy perimenopause bleeding is a very hard symptom to experience. It can cause significant emotional distress and lower your quality of life. If this is you, seek help now. And if you aren't satisfied, go somewhere else and keep on seeking help, because you do not have to keep suffering. Thank you.